For those of you who don't know, Erie St. Clair Lynn, which runs from Grand Bend down to Point Pelee and Pelee Island and across over to Windsor, is a significant Lynn in the province of Ontario, and it's significant in a way that maybe is not so good. It's significant because we have higher rates of hypertension, we have higher rates of diabetes, we have higher rates of smoking, we have higher rates of obesity, we have higher rates of congestive heart failure, we have higher rates of chronic lung disease. So we stand out heads and shoulders above the rest of the province in measures of long-term health status and chronic disease that we want to be able to change.
There's approximately 4,500 visits a year to our emergency departments in Chatham-Kent. So quickly, that's around 12 a day. Now, it may not sound like 12 a day, but for the doctors that are in the room here that get 12 patients a day on COPD, if they could do without those 12 patients, they'd say thank you. Because our waiting times are, although we're doing quite well here, it's still a 4-hour wait for our less acute. The average cost of that visit is $150, but when the patient is admitted, that's on average a 10-day stay at $1,000 a day. You can see the cost to the system. But let's think about what the cost to the patient is. They're not getting the care that they need. They don't have that wraparound care that they need. So to pull it all together, we got the best of the best together to work on a team to tackle this issue and come up with best practice. We called it the COPD working group. We were very original with that. But they were smarter than that, and they created a new care path called the Breathe Well program. Makes a lot more sense than the COPD work group, but it makes sense to those patients out there that are suffering with COPD.
We're seeing more patients coming back to the emergency department within 30 days after their visit. We're seeing more people in the inpatient bed within 30 days of their hospital discharge. And it's increasing since our last baseline period, and we need to do something about that. One could look at it from a health economics perspective and approach it from that lens, but my lens is from the patient perspective. These patients are short of breath, they're feeling unwell, it's a very uncomfortable situation, and I think that we can do a better job of maintaining their health status and looking after them. What's happening in the system right now is that a lot of individual providers are doing just a fantastic job of caring for people with chronic lung disease, but we're doing so in a structural system such that we're each doing it by ourselves. And the whole effort that we've undertaken with the COPD task force is to do this collectively so that we're sharing an understanding of the patients we're serving, that we're integrating and we're taking to these islands of excellence that we have and we're weaving them together into a quilt of a comprehensive network of care for these patients that we're caring for in the community in the hopes that we can maintain their health status, keep them well, and so they will have less need to interact with the emergency department, the hospital system, and will be feeling better about their chronic disease status.
There's wonderful resources, so please have a look at this pamphlet. We have online learning education, we have videos, we do workshops across the province of Ontario. The website is olapep.ca. Please go to our website and have a look at what we have to offer, because we have so many resources to assist you. Also at the Ontario Lung Association, we have a helpline. Our lung health information line is staffed with certified respiratory educators who are also registered respiratory therapists Monday to Friday, 8:30 to 4:30. We don't only have to answer calls for people who suffer with chronic lung disease across this province, but we're here for healthcare providers as well. And as family health teams and CHCs are starting to start lung health programs, we've been able to assist a lot of lung health programs get developed and give them some support. So please call our helpline, 1-888-344-LUNG. Our phone number is on all of our resources. Also, we've given everybody our COPD resource order forms, our asthma resource order forms. Have a look at them.
Tonight we're talking about COPD, the need for follow-up care and looking after these patients, access chronic disease. Health Links is coming. In order to care for that population that's defined of about 500 people, access, follow-up, management of chronic disease in these patients. So I think this is a great opportunity to see the primary care sector, the secondary care sector, quality improvement plans in primary care, the activities of the LIN, and the activities that we're all doing has got a remarkable opportunity to come together in this really coordinated, comprehensive format around chronic lung disease patients and all our patients with chronic disease that need our help the most.